There's an outstanding event in the PD area at Francis Marion University. We'll tell you all about it coming up next on Carolina People. Good morning. Welcome to Carolina People. Today we're at Carolina's hospital system here in the city of Florence. We're focused on the PD area heart walk coming up at Francis Marion University on October 26th. And we're visiting with Dr. Robert Luke of PD Cardiology. Dr. Luke, thanks so much for being with us this morning.
Thanks for having me.
Are you from around the area, Dr. Luke?
Actually, I'm from Chicago.
Chicago?
Correct.
Is that close to Bennettsville or Hartsville?
It's slightly north, just on the shores of Lake Michigan.
Okay, great area. And how long have you been in the PD area?
Almost 10 years now.
10 years. Tell me a little bit about PD cardiology. When folks think of the PD, they think primarily of the counties surrounding Florence County. Did I understand that there's a location in Horry County as well?
Correct. PD cardiology, we have offices in Loris as well as in Seacoast, and we try to cover the PD as best we can. It is a very spread out region.
Can you talk for a second about how long you've been in practice, and then a little more about actually being a cardiologist?
Sure. Well, I've been in practice with PD cardiology almost 10 years. I came here directly after fellowship, and it's not as simple as go to medical school and go out and practice. There was residency and fellowship, and so that takes several years before you actually are ready to go out and practice.
So for a viewer who's not familiar even possibly with the medical profession, you'd go through college, and then you'd go through medical school. That's another 4 years.
Correct.
And then residency.
Correct.
And then and how long would that be?
Residency is 3 years.
3 years, and then fellowship. What exactly is
Correct.
Fellowship?
Fellowship is where you do your specialization training, and
Okay.
mine happens to be in electrophysiology, which is even a subspecialty of cardiology.
Electrophysiology.
Correct.
Are there many electrophysiology specialists here in the PD?
You're talking to them.
Oh, gal. Well, this is a big room.
I admit.
Throughout the PD region.
Correct. And the nearest electrophysiologist would be in either Columbia or Charleston.
Okay, great. What exactly is an electrophysiologist?
We study the electrical system of the heart, and so we've gotten a lot of press recently with our Vice President Dick Cheney having an implantable defibrillator, and that's one of the aspects we do. So people who have irregular heart rhythms, we work on those that are both life-threatening as well as those that are annoying.
And cardiovascular disease is a real problem in the PD area?
Correct. The Southeast in general and the PD in particular is a very high risk group.
Why do you think that would be the case?
I think it's a whole host of factors. Clearly, there are diet and lifestyle changes that need to be made. Mm-hmm. We are in tobacco country, and I think it's a combination of all those factors in general.
Are there some developments in particular that are occurring in heart disease research right now? Anything in particular that folks would need to be aware of or want to be made aware of?
Sure. I think people in general are hearing a lot about stents, which my interventional colleagues, the plumbers as I like to call them, and I'm the electrician, they're having advancements with those in terms of hopefully people will not have recurrences of their blockages. And then the big focus really needs to be on public education and the people themselves changing their lifestyle risk factors.
Mm-hmm. You feel pretty confident the Heart Association's research has helped develop some instruments to really fight heart disease?
Correct.
What are some of those? What are some of the areas in particular that, as a cardiologist, you're able to delve directly into research in a community? You're more of a practitioner as opposed
Correct.
to a researcher. Are there aspects when patients that you've seen in the recent past that have caused you to think of something that would help prompt or help assist in some research?
I think it's also in an indirect way too. The research that the American Heart Association sponsors is on a national level,
yes.
And so everyone benefits, including the Southeast. And from a practitioner point of view, we may not be involved directly with all the trials, but we get the benefits downstream of the advancements in medicine. Mm-hmm. So that's, I think, where we fit in.
How does PD cardiology interface with hospitals? Do you travel to hospitals to perform surgeries, or do patients come to the locations throughout PD cardiology? Obviously today we're at Carolina's hospital system, a huge location there there's cardiologists here on staff as well
Correct.
as. Do you ever come to Carolina's hospital system, for instance?
Oh, yes. Oh, yes. In fact, as soon as we're finished, I'm going to go upstairs and visit with some people. But we do both of what you said. We do come to the hospitals where the patients are located, and then we also have our outreach offices as well. Clearly, for major cardiovascular procedures, you need to be at a major medical center.
Obviously, when folks think of the American Heart Association, they think of fighting heart disease and also strokes. PD Cardiology has been a sponsor not only of the Heart Walk, but of the Heart Gala, the Heart Association's Gala, and other Heart Association events. Is there a particular reason that PD Cardiology decided to be a corporate sponsor this year of the Heart Walk? Anything that prompted you in particular?
I don't think there's anything in particular. As a group, we are committed to not only helping each individual patient as we see them, but improving the community as well in terms of reaching out to those people who hopefully won't have to become future patients if they work on those lifestyle changes.
Yes, and speaking of some of those lifestyle changes, are there some easy exercises or techniques that you encourage patients to get active in, either after their time with you or even beforehand?
Sure.
Surely the goal of the Heart Association is to get the word out about fighting heart disease.
I think that is the big message, is to get the word out, and exercise is part of it. Eating a low-fat, low-cholesterol, low-sodium diet is one. Refraining from smoking. And the one that no one can change is your genes, your genetic background. But so we can work on these other measures to hopefully improve everyone's well-being.
Can you tell viewers real quick about where you attended medical school?
Sure.
Dr. Libby?
Yeah, I was at Johns Hopkins up in Baltimore, Maryland for both medical school and residency.
Right.
And then did my specialty training at Washington University in St. Louis.
Great. Do you have a challenge that you would want to institute for other PD area medical professionals? Is there, obviously the PD Cardiology is committed as a corporate sponsor as well as encouraging patients and other professionals within your group to get out and walk on the 26th. Do you have a challenge for other medical professionals in the area?
In terms of the specific Heart Walk, the challenge is obviously to get as many people out there and walking and get the message out. In terms of patients in general, obviously people are learning about their cholesterol, and the other number which they'll probably need to start sticking in their head is ejection fraction. How well does their pump, the heart pump, function? Because that has a lot of implications in terms of prognosis.
Dr. Robert Luke, 10 years with PD Cardiology, native of Chicago, but happily now a PD area citizen and one that's committed to serving not only his efforts with the Heart Association, but also heart patients on a regular basis. Dr. Luke, thank you so much for being with us this morning. Stay tuned for more Carolina People coming up next. Good morning. Welcome to Carolina People. This morning we're at Carolina's hospital system. We're in the city of Florence, and we're focused on the PD area Heart Walk coming up on October 26th at Francis Marion University. We're visiting with Francis Marion University's Director of Community Relations, Libby Cooper. Libby, thanks so much for being with us this morning.
Oh, it's a pleasure to be here. Thank you.
It's been such a great week already focused on the PD area Heart Walk. October 26th is the big date. I think last year the Heart Walk was held at Francis Marion.
That's right.
Was that the first year it had been held out there?
It was the first year, and we think it was a wonderful success, and we're just so glad that it's going to be there again this year.
I hope that'll happen many years to come.
I hope so.
Tell me real quick about the route that walkers will be taking on the campus. I understand there's a segment where they could walk a mile or they could walk 3 miles. Is the campus pretty easy to locate?
The campus is very easy to locate, and I think that's one of the reasons that, you know, it was selected as a site for the Heart Walk, because it is convenient and very accessible. Mm-hmm. And the 1 mile walk, and we have a beautiful campus. Yeah. The 1 mile walk will pretty much stay on some of the main roads through the campus. Now the 3 mile walk, you get kind of off the beaten path and walk through housing, through the part of the woods, and the landscaping is beautiful, and through the classroom and campus buildings. Well, you stay outside, but you get a good overview of the campus on the 3 mile walk.
Okay, great. Real quick, Libby, about yourself. before we get back to the walk, are you a Florence native?
I am a Maysville, South Carolina native, and if you don't know where that is, that's
No.
Sumter County.
Okay,
About
great.
30 miles from here.
So you're a PD area native.
I've been here long enough to count as a PD person, I think.
Golly. What about, in your involvement as Director of Community Relations for Francis Marion, what exactly does that entail?
Well, the Community Relations Office works with a variety of segments of the community, other organizations, for the betterment of both Francis Marion University and the region we serve and the community we serve. So we try to improve what we call town and gown relations, and we do that through special events, through publications, through all kinds of activities to get people involved in the life of the campus.
Very definitely. You know, it was so exciting last week. As you remember, we were focused on the Northeastern Strategic Alliance, of which Dr. Carter is one of the principal participants, and he talked about one of the big goals of the alliance, and really of Francis Marion, is bringing these 10 counties together, bringing so many communities together under a common goal. And as you talk about Francis Marion being so centrally located, the idea of having the walk there is probably one that they've been, I know in the past they've been at Florence Darlington Tech, which is a prime location, and since Florence and Darlington are two of the principal counties that are focused on the PD area Heart Walk, surely there are goals to bring in adjacent counties. Marion County, I think this year they've added Dillon County to the walk. A goal of 275,000. Will Francis Marion be putting out a team as well? Are there students involved?
We'll have probably at least 7 or 8 teams, and many of those teams do involve students. For example, the women's basketball team will be participating.
Right.
Let's see, some of the student groups, our Student Alumni Association will be participating, the resident assistants in the dormitories. We'll probably have some student clubs. I think last year the Psychology Club participated. So the students have a great time with it, even though it's a little early on a Saturday morning for some of them. But we encourage students, faculty, and staff to be involved. And I think last year we had the 3rd highest number of walkers there.
Is that right? You
So
mean folks associated with the university?
That's right.
That's amazing. With so many walkers coming on campus and so much preparation involved, how are you going about getting ready, getting the campus ready? I'm sure you've got to contact everyone to let them know that they're going to have a slew of thousands of walkers coming on campus.
You know, it is a big event, and we look for at least 2,000 walkers.
Oh, great.
But we have a wonderful staff, grounds and maintenance, and they're used to doing big events. And it's all in the details. They start planning well in advance, and the folks with the Heart Association here, Mona Carter and her team, do such a wonderful job in planning. So we just begin planning early and have all the details down and pray that it doesn't rain.
Yes, very definitely. You know, I know last week, again, sorry to go back to Francis Marion, but we were focused on the PD International Festival, which is scheduled to be held October 5th. So Francis Marion's going to have 2 huge events. Are there any other events going on either during the month of October or upcoming months that folks would want to become aware of?
I think, you know, those are the big ones coming up immediately. The big one we do in the spring is Arts Alive, which is which is a big tradition for this area. 25 years now of Arts Alive. And the Arts Alive International Festival and the Heart Walk are 3 of the biggest.
Right. What about, have you had any family that have attended Francis Marion formally?
My husband is a Francis Marion graduate, and he actually went back as a mature student when, you know, he was not the traditional 18 to 22-year-old, and finished in '89 there and had a wonderful experience there.
Oh, yeah, very definitely. It's thinking of that campus, when folks come on the campus, when walkers are driving in from around the area, if they've never been to the campus, are there things they should think of in particular, good places to park? I'm sure, as you said, the grounds and maintenance crews have thoroughly laid everything out. The signage will be well done. Are there any hidden parking spots that you may want to...
Those that have been on campus a long time know where a few of those hidden spots are, but parking will be ample, and that shouldn't be a problem for anybody. As they turn at the traffic light, there are 4 or 5 parking lots, you know, as you turn onto any of the gates into campus.
Okay.
And you'll see the tents and the activities and the signs and the balloons, so we won't be hard to find.
I'm sure. I think Mona Carter said folks will be coming out at 8:30 to register, even as early as 8:30, and the walk will actually begin at 10. You said there are walkers, some will walk a mile and some will walk 3 miles.
Right.
The PD International Festival, a totally separate event, are there activities, to go back to that, but are there an involvement that day, just real quick, the time, the times for the PD International
Well,
Festival?
the PD International Festival goes from 11 to 5.
Okay.
And as you know from talking about it last year, I think this year's festival is going to be great just because of the variety of performances we have with an international focus.
Yes.
But everything's in a confined area, so you'll just see one part of the campus that day.
Right.
Come to the Heart Walk, you're going to see a lot of the campus.
Libby Cooper, Director of Community Relations for Francis Marion University. This week's been focused on the Heart Walk, but Francis Marion's got so many activities going on. If you haven't been to the campus, if you can't attend the PD International Festival, if you can't attend the Heart Walk on October 26th, surely take the time to come out to the campus. Would there be a number of people could call, Libby, if
Yes,
they
they
wanted
could
to?
certainly call the Community Relations Office, 843-661-1225. There is something going on all the time. You know, we've got our athletic department with our sports, fall sports starting. We have our artist series that generally has a program each month. So our art galleries are open. So if you come to campus, we'll find something for you to do.
Very definitely. Libby Cooper, Director of Community Relations for Francis Marion University. Thanks so much for being with us this morning.
Thank you. Enjoyed it.
Stay tuned for more Carolina People coming up next. Good morning. Welcome back to Carolina People. This morning we're at Carolina's hospital system in the city of Florence. We're focused on the PD Area Heart Walk coming up at Francis Marion University on October 26th. We're visiting with Robyn Benjamin, the Assistant Director of Community Relations and Volunteer Coordinator with Carolina Pines Regional Medical Center. Robyn, thanks so much for being with us this morning.
Thank you. I enjoy being here.
The commitment of Carolina Pines Regional Medical Center for so many years supporting the American Heart Association, and you personally being active with the Heart Association. How long have you been active?
I've been with the hospital actually for 10 years, and we began working with the Heart Association about 8 years ago.
Great. Had you personally been active with the Heart Association prior to joining the hospital?
Not prior to that. It became a job commitment at first, and through the years of doing the regular Heart Walk every year and being the team leader, it became a personal commitment for me.
Very definitely. How long have you been active in health services?
Well, about 10 years now, and I think that experience, seeing what goes on in a medical facility, the way that heart disease touches people's lives, has made a big impact on all of us that work at care facilities.
Are you a PD area native?
I've been in this area for about 23 years now.
Boy, quite a while. And Carolina Pines Regional Medical Center, where's that located? Can you tell viewers whether they're on the Grand Strand or in southeastern North Carolina, exactly where the
We're in
center is?
Hartsville, South Carolina,
Okay.
on Highway 151, right on the outside of town. Very easy to get to, easy access. We're about 20 miles from Florence.
I'm sure you have patients from all over the PD, but your primary service area would be?
Right. We serve Darlington County, Chesterfield, Lee County, that area around us.
You said it was part of a job requirement to get active with the Heart Association, the Heart Walk. Was that, and have you had any family?
Actually, I have had family touched by heart disease. My mother had a valve replacement done about 5 years ago, and my father has had stents put in his heart. So I think it touches all of us in a lot of personal ways. At some point in our lives, we probably will all be touched by heart disease.
Robyn, I understand last year you raised the most money individually as a personal walker. How did you go about doing that?
Well, we do have a lot of generous people in Hartsville. But I used a lot of the connections we have with our vendors, people that we work with on a weekly basis in the hospital, and I asked them about doing the Healthy Heart Trail Markers, which is a big promotional item that the Heart Walk uses. And I was lucky enough to get a number of businesses to participate in that, as well as our Doctors Who Care board. It's a board that displayed at the walk lists all the doctors who've donated $100 or more.
Right.
So working with all the physicians, it was quite nice to be able to contact them and receive the donations.
Could you tell viewers real quick what the trail markers are?
These are signs purchased by the businesses for $250, and they have information on there that's heart-related, and they also advertise the business's name and location.
Right. Was there a big kickoff that was held at the hospital, either for this year's walk or formerly?
Recently, we did have a big kickoff walk at Carolina Pines and had approximately 100 people in attendance.
Right.
So it shows you we do have good community support.
Mm-hmm. Do you personally, or I was wondering about your personal Heart Walk goals, and then maybe about the goals of Carolina Pines itself. Are there numeric goals, numbers of walkers that you hope will be out there, as well as financial goals?
Each year we do set team goals, and last year our goal was 10,000, and we were able to surpass that by about to 11,000. So I think we've set the same goal, reach $10,000 in total donations, and we expect about 50 walkers to participate from our team.
50 walkers.
Right.
How many of those will actually be from Carolina Pines Regional Medical Center? Will those, or will those primarily be?
There'll be employees, family members.
Family members, yeah.
I'll have my husband and my daughter out there walking with me. So it's a great fun family fun event, and we all enjoy it.
It sure is. It was amazing. A couple weeks ago, we focused on the Waccamaw Division's 11th annual Heart Walk, which is coming up actually on October 19th. And there was someone from a local corporation that had talked about her Girl Scout troop was going to come out and walk. It was AVX as the corporation. Angie had said that her Girl Scout troop was going to come out and walk along with the AVX team. So there are members in the community, whether it's your family, they come under the Carolina Pines Regional Medical Center team. It's so great to be able to go out and get those folks. It gives a lot more opportunity to promote Carolina Pines, as well as to promote the camaraderie of being out there on walk day.
Exactly.
Francis Marion, such a good location. Had you walked, obviously, not only last year, but in the past it had been held at Florence Darlington Tech. The move to Francis Marion was hopefully to expand into Marion County and to Dillon County. I think this year they've added Dillon County as one of the prime counties for the walk.
Throughout the years, we've used different locations. We've walked at the Darlington Racetrack. We've used the drag strip. And then we've also done it at Florence Darlington Tech. But last year at Francis Marion, I found that to be a very nice change. The expansion. We have so many walkers involved now that you do have to go to an area that gives you lots of room to spread out. But everyone has a different pace. We have some that'll run, some that'll walk. It's nice to have the room to spread everybody out. Plus the campus was absolutely gorgeous, so we did enjoy that.
Yes, yes. It should be a spectacular day. Let's pray for good weather on the 26th.
Yes.
I understand that Carolina Pines Regional Medical Center is also a corporate sponsor of the event. Was there anything in particular that prompted that sponsorship?
Well, just our commitment to all of the healthcare organizations. We know that the research and education that's going on a daily basis is always working to enhance the lives of all of us. And being a healthcare facility with the most modern technology, we're interested in participating in any of that research that's going to create medical advances.
Why do you think the community should get involved with the American Heart Association?
Well, just simply because heart disease is such a prevalent thing in today's society, and the fact that all of us at some point in our lives will probably be touched by it. Our commitment to it, to improving things today, will make better tomorrows for all of us.
Very definitely. Robyn Benjamin, 23 years in Hartsville, 10 years with Carolina Pines Regional Medical Center as the Assistant Director for Community Relations, actively getting volunteers out, not only to support the Heart Walk on October 26th, but in so many segments of the medical center's community. Robyn, thanks so much for being with us this morning.
I enjoyed it. Thank you.
Stay tuned for more Carolina People coming up next. Please call 843-665-0985.